Question 1. A nurse is evaluating a patient with left-sided heart failure. Which clinical finding is expected? A. Jugular vein distension. B. Pulmonary crackles and dyspnea. C. Hepatomegaly and ascites. D. Warm, flush skin. Answer: B. Pulmonary crackles and dyspnea. Question 2. A nurse is teaching a patient with heart failure about fluid restrictions. Which patient statement indicates effective understanding? A. I will drink a glass of water every hour. B. I will limit my fluid intake to what the nurse tells me. C. I'll keep a log of everything I drink throughout the day. D. I will only count water, not soup or gelatin. Answer: C. I'll keep a log of everything I drink throughout the day. Question 3. Which task is most appropriate for the RN to delegate to an experienced LPN/LVN caring for a patient with chronic heart failure? A. Teaching dietary restrictions. B. Performing initial physical assessment. C. Monitoring daily weight. D. Evaluating response to diuretic therapy. Answer: C. Monitoring daily weight. Question 4. The nurse is reviewing medications for a patient with heart failure. Which drug would most likely improve myocardial contractility? A. Furosemide. B. Enalapril. C. Digoxin. D. Spironolactone. Answer: C. Digoxin. Question 5. A patient with heart failure and chronic kidney disease has a potassium level of 6.1 milliequivalent/L. What is the nurse's best initial action? A. Administer potassium supplements. B. Restrict dietary potassium immediately. C. Notify the healthcare provider. D. Increase fluid intake. Answer: C. Notify the healthcare provider. Question 6. A patient with heart failure is experiencing increased fatigue and exercise intolerance. What diagnostic test is most useful to evaluate cardiac function? A. Chest X-ray. B. Electrocardiogram. C. Echocardiogram. D. Cardiac enzymes. Answer: C. Echocardiogram. Question 7. Which action by the nurse demonstrates priority care for a patient with worsening heart failure? A. Educating the patient about sodium intake. B. Encouraging ambulation twice a day. C. Monitoring daily weights and lung sounds. D. Offering frequent high-calorie meals. Answer: C. Monitoring daily weights and lung sounds. Question 8. The nurse notes that a patient with heart failure has a BNP of 980 pg/ml. What does this finding indicate? A. Normal fluid status. B. Mild dehydration. C. Worsening heart failure. D. Improved cardiac output. Answer: C. Worsening heart failure. Question 9. A nurse is reinforcing medication teaching for a patient prescribed furosemide. Which instruction is most important? A. Take this medication before bedtime. B. Weigh yourself weekly. C. Eat foods high in potassium. D. You may skip a dose if you're feeling well. Answer: C. Eat foods high in potassium. Question 10. Which change in assessment would be most concerning in a patient with heart failure? A. Decreased heart rate from 82 to 76 BPM. B. BP change from 130/84 to 110/70 mmHg. C. Development of new bilateral lung crackles. D. Weight gain of 0.5 pounds in 2 days. Answer: C. Development of new bilateral lung crackles. Question 11. Which assessment would best evaluate the effectiveness of diuretic therapy in heart failure? A. Skin turgor. B. Daily weight. C. Blood pressure. D. Respiratory rate. Answer: B. Daily weight. Question 12. The nurse is prioritizing care for 4 patients. Which patient should be seen first? A. A heart failure patient reporting shortness of breath and anxiety. B. A diabetic patient with fasting blood glucose of 210 milligrams per deciliter. C. A COPD patient requesting assistance with ADLs. D. A post-op patient asking for pain medication. Answer: A. A heart failure patient reporting shortness of breath and anxiety. Question 13. A nurse notices that a patient with heart failure is suddenly more confused and restless. What is the nurse's priority? A. Check oxygen saturation. B. Administer PRN lorazepam. C. Reorient the patient. D. Notify the healthcare provider. Answer: A. Check oxygen saturation. Question 14. Which dietary choice by a patient with heart failure requires intervention? A. Grilled salmon with brown rice. B. Deli ham sandwich with pickles. C. Steamed broccoli with baked potato. D. Fresh fruit salad. Answer: B. Deli ham sandwich with pickles. Question 15. The nurse is monitoring a patient with heart failure for signs of fluid overload. Which finding is most concerning? A. Mild pedal edema. B. Increased abdominal girth. C. 1 pound weight gain in 1 day. D. Occasional dry cough. Answer: B. Increased abdominal girth. Question 16. A patient with chronic heart failure is being discharged. Which statement indicates the need for further education? A. I'll weigh myself every morning before breakfast. B. I'll take my diuretics even if I'm not short of breath. C. I will drink at least 3 liters of fluid daily. D. I'll avoid canned and processed foods. Answer: C. I will drink at least 3 liters of fluid daily. Question 17. Which assessment finding in a heart failure patient suggests a positive response to therapy? A. Increased respiratory rate. B. Pink, frothy sputum. C. Clear lung sounds. D. Elevated BNP. Answer: C. Clear lung sounds. Question 18. A patient with heart failure is receiving digoxin. Which electrolyte imbalance increases the risk for digoxin toxicity? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer: B. Hypokalemia. Question 19. A patient is prescribed both digoxin and furosemide. What should the nurse monitor closely? A. Urinary output. B. Blood glucose. C. Potassium levels. D. Pulse oximetry. Answer: C. Potassium levels. Question 20. The nurse is teaching a patient with heart failure about recognizing signs of worsening condition. Which symptom requires immediate reporting? A. Fatigue after walking short distances. B. 1 pound weight gain in 24 hours. C. Awakening at night short of breath. D. Mild swelling in the feet. Answer: C. Awakening at night short of breath. Question 21. A patient with heart failure is prescribed metoprolol. Which assessment requires immediate action before administration? A. Heart rate of 58 BPM. B. BP of 140/86 mmHg. C. Respiratory rate of 20 per minute. D. Temperature of 98.2 degrees Fahrenheit. Answer: A. Heart rate of 58 BPM. Question 22. A patient with heart failure reports feeling dizzy when standing. What is the nurse's best action? A. Notify the healthcare provider immediately. B. Teach the patient to change positions slowly. C. Encourage more fluids. D. Reduce physical activity. Answer: B. Teach the patient to change positions slowly. Question 23. Which finding suggests a patient's heart failure is improving? A. Increased BNP. B. Decreased urine output. C. Reduced shortness of breath with activity. D. Increased pedal edema. Answer: C. Reduced shortness of breath with activity. Question 24. What is the most accurate indicator of fluid status in a heart failure patient? A. Daily weight. B. Intake and output. C. Blood pressure. D. Skin turgor. Answer: A. Daily weight. Question 25. Which order should the nurse question for a patient admitted with acute decompensated heart failure? A. Furosemide 4 push. B. High sodium diet. C. Oxygen at 2 liters per minute via nasal cannula. D. Bed rest with bathroom privileges. Answer: B. High sodium diet. Question 26. A nurse is caring for a patient with heart failure receiving digoxin. Which symptom is a concern? A. Increased appetite. B. Visual disturbances. C. Slight tachycardia. D. BP 130/78 mmHg. Answer: B. Visual disturbances. Question 27. The nurse finds a heart failure patient confused and restless. What should the nurse do first? A. Reorient the patient. B. Administer PRN sedative. C. Assess oxygen saturation. D. Notify the provider. Answer: C. Assess oxygen saturation. Question 28. What should the nurse include when teaching a heart failure patient about low-sodium diets? A. You can eat smoked meats occasionally. B. Avoid canned foods and frozen meals. C. Sea salt is a healthier option. D. You should limit fresh fruits. Answer: B. Avoid canned foods and frozen meals. Question 29. Which finding indicates right-sided heart failure progression? A. Crackles in the lungs. B. Pulmonary congestion. C. Distended neck veins. D. Increased ejection fraction. Answer: C. Distended neck veins. Question 30. A nurse is evaluating the effectiveness of patient teaching. Which statement indicates correct understanding of heart failure management? A. I will stop my medications when I feel better. B. I will weigh myself weekly. C. I will limit sodium intake to less than 2 grams daily. D. I can eat salty snacks if I take my diuretic. Answer: C. I will limit sodium intake to less than 2 grams daily. Question 31. Which instruction is most appropriate for a patient discharged with a new prescription for lisinopril? A. Check your blood pressure weekly. B. Avoid foods high in potassium. C. Stop taking the drug if you feel lightheaded. D. Take with antacids to reduce stomach upset. Answer: B. Avoid foods high in potassium. Question 32. A nurse is caring for a patient with chronic heart failure. Which clinical finding requires follow-up? A. Oxygen saturation of 94%. B. Weight gain of 4 pounds in 3 days. C. BP 122/78 mmHg. D. HR 74 BPM. Answer: B. Weight gain of 4 pounds in 3 days. Question 33. The nurse is prioritizing care. Which patient should be seen first? A. A patient with chronic heart failure complaining of mild fatigue. B. A patient reporting sudden onset of orthopnea. C. A patient asking for discharge teaching. D. A patient with bilateral 1+ leg edema. Answer: B. A patient reporting sudden onset of orthopnea. Question 34. A patient with heart failure is prescribed digoxin and furosemide. Which lab value is most concerning? A. Potassium 3.0 milliequivalent/L. B. Sodium 138 milliequivalent/L. C. Creatinine 1.1 milligrams per deciliter. D. Magnesium 1.8 milligrams per deciliter. Answer: A. Potassium 3.0 milliequivalent/L. Question 35. Which task is most appropriate for a nurse to delegate to a UAP caring for a heart failure patient? A. Monitoring oxygen saturation trends. B. Providing discharge education. C. Measuring daily weights. D. Assessing for edema. Answer: C. Measuring daily weights. Question 36. Which instruction is most important when discharging a patient with heart failure and low health literacy? A. Provide printed material in technical language. B. Explain medication use with pictures and teach back. C. List all side effects of medications. D. Encourage the patient to research medications online. Answer: B. Explain medication use with pictures and teach back. Question 37. Which meal choice indicates the patient understands dietary restrictions for heart failure? A. Canned soup and crackers. B. Grilled chicken with fresh vegetables. C. Ham sandwich with chips. D. Ramen noodles with broth. Answer: B. Grilled chicken with fresh vegetables. Question 38. A patient with heart failure is being seen in clinic. Which assessment finding requires priority intervention? A. Fatigue during activities. B. Heart rate 90 BPM. C. Productive cough with frothy sputum. D. Mild bilateral ankle edema. Answer: C. Productive cough with frothy sputum. Question 39. What is the rationale for prescribing an ACE inhibitor in heart failure? A. It increases preload. B. It promotes fluid retention. C. It reduces afterload and improves cardiac output. D. It slows the heart rate to reduce oxygen demand. Answer: C. It reduces afterload and improves cardiac output. Question 40. Which finding suggests the need to evaluate a heart failure patient for pulmonary edema? A. Decreased BP. B. Dry cough. C. Sudden confusion and agitation. D. Increased urinary output. Answer: C. Sudden confusion and agitation. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.